Welcome back to County Connection. For our final segment of this episode, we're going to be talking about safety precautions related to edible marijuana products. And I have with me Laurie Blackwell from Healthy Futures and Chief Shannon Haynes from the Breckenridge Police Department. Welcome, ladies. Thanks for coming.
Thanks for having us.
All right. So recently in Colorado, retail recreational marijuana was legalized, which shifted the landscape somewhat in terms of both of the work that both of you do around this particular drug. And one of the biggest factors, or I guess one of the biggest shifts, has been the availability of edible marijuana products now out on the market. So we're going to talk a little bit about what the implications are for health and safety statewide, but also in our local community, and some of the steps that are going on to address some of those safety issues. So Laurie, why don't you start out just telling us a little bit about Healthy Futures. I'm sure most people are probably familiar with Breckenridge Police Department, but may not be with Healthy Futures. So give us a little background on that.
Healthy Futures Initiative is a very collaborative effort to bring a large coalition of people together to work on youth prevention and education around substance abuse and suicide prevention.
So specific to marijuana edibles, what would you say from each of your perspectives, what are you seeing out there with these particular products in terms of their prevalence, or where you're seeing some issues with underage use, or what kind of has jumped out to you in the past year?
I'd say, just to start, that edibles was one of the things that took us by surprise. We had prepped an awful lot for the start of retail sale and educating people on what they could and couldn't do, what was legal, what wasn't legal, and worked with establishment owners to try to get point of sale educational information out and things like that. And we did have one establishment that put on their point of sale notification a little piece about edibles, but we didn't really have any idea how edibles would kind of take off and how people would really see that as a great option for them to be able to use marijuana without having to smoke it, because there are limited places where you could smoke it. So when that first part of 2014, we saw a lot of folks, or more than we had seen before, that overdose, for lack of a better word, just used too much of the product and got sick and things like that. And so we started kind of tracking that data, and we saw more than we expected to see in that realm. So we started trying to address that issue. Another side issue that we found was people purchasing product to use and then not being able to take it home with them because they lived out of state and whatnot. So they'd leave it in a hotel. And it's long been a practice at lodging establishments that housekeeping staff, if there's unopened food items, they can take those and consume them or take them home. So we had some hotel staff that consumed marijuana products because they didn't realize what that the chocolate bar that was there was a marijuana infused chocolate bar. And so not knowing A, what they were eating, and B, how much they should be eating, they'd eat an entire candy bar, which could be 100 milligrams of marijuana in it, and they got very sick. So we started kind of reframing our education towards those two issues. And again, we tried to be very proactive, but it was something we didn't anticipate.
Right. And then what are the implications in terms of kids and these edible products?
The concern was that all of these things that look like commercial products that kids have seen before now might be infused with THC, and a large amount of it, and not really know. And so we just really still don't feel comfortable about the safety for kids, and that's really the issue for us, is that we hope that adults who it's legal to purchase, we hope that if they purchase, they take it home, they have a very small amount, whatever is appropriate for their size and weight, and that they do lock it up. But we can't guarantee that. So we have big concerns about this.
So let's talk a little bit about the labeling. So what are the current requirements as far as labeling edible marijuana products?
Well, they're different or they were different, between medical and retail.
Okay.
And medical is it's important to understand that medical is a different product. So medical can be higher doses of THC in those products than you would normally see in a retail product. They have been working on the state level with a wide-ranging coalition, a very diverse group of people, to try to come up with some labeling requirements that would kind of help people understand what it is in the package. But those wheels are moving slowly. So as of February, there was some changes that require an opaque package, require that it can lock, things like that. But what we're still missing is an identifiable marker on the internal package to tell you that it's marijuana, and the regulation of the medical dosages, which I think will be changing to no more than 100 milligrams in either kind of product, and being able to be separated into serving sizes and things like that, because when you have a cookie that is 100 milligrams and it's one cookie, it's not easily dividable into serving sizes. So trying to get to packaging that allows for you to understand what your serving size is. But we feel anyway, still quite a ways away from packaging that really truly does protect kids. The locking packages that they're going to have, they're very useful, but if you don't re-secure it, or you throw it away when it's meant to be reusable.
It is meant to be reusable.
But what people do with that when they get home with it is a different issue.
Right. So in regard to the dosages and being able to ascertain what is a dose and how is the product divided up into equal doses, so I understand that that's where where you see some of the issues taking place with edibles, is that people don't have a good sense of that. Is that?
It is, and there's kind of a pro and con issue to that. The pro piece is if you know what a serving size is, you'll use the appropriate dose for your size and your experience and that kind of thing. But the flip side of that is then there's still potentially product left over, and we want to make sure that that's packaged so that kids can't get to it and they know what it is that they're possibly consuming. The flip side of that is, that's a danger that you have product left over and that, kids can get to it. The other side of that is if you don't split it up into proper dosages, then people are over consuming. And so, having the dosage, the serving size, I suppose, is a better way to look at that. To have a serving size split out is a great idea. We just really need to get to, okay, I've used my appropriate serving, now what do I do with the rest of it? And how do we make sure and how do we help people make sure that kids don't get it?
Right. So, so let's talk about the little kids first.
With the little kids, again, it might go home in a container that they can't get into, hopefully. You would take your marijuana, your edible product, you'd put it inside the bag, they seal it up, they send you out the door, you go home, you unseal the bag. We are really trying to work with people to lock it up, put it away, don't ever leave it out. In terms of teens, we're finding, I think in Denver, a couple of weeks ago, there was a group of kids that came into their school with marijuana edibles and were selling them to other students. We have the situation where they're selling to a knowing student. We have a situation where they might be selling to a student who didn't know what it was, or giving it to someone in a middle school or whatever. So we're seeing a little bit more of that. And the marking on the package that gives the THC level is very, very, very small. We're seeing that middle school around the state, high school around the state have actually sort of embraced this marijuana edible because, again, you don't smoke it. You could have it in school and it looks so much like the products that we're used to. So it's really hard for administration and school people to really have their hands on what's going on in a lunchroom, say, or in a hallway, because it's not marked.
Right. So it's again the importance of individuals who may have teens in the house or be around adolescents to really take some extra precaution about keeping that, locking it up, like you say.
Yeah.
And I know that at Healthy Futures you talk a lot about being prepared to have conversations with your kids about these issues, because the more that you do have conversations, the less likely they are to end up abusing substances of all types, not just marijuana.
Right. We do know that contrary to what parents think, kids really do listen to them, and they really do care what they think. And we sort of go with the philosophy of lots of small conversations.
Okay.
And if you don't know the answer, say, let's go look it up. Let's do that together. Let's find out the answer to that.
That's a great tip.
Yeah, so on our healthyfutures.org website, we have lots and lots of resources for parents.
All right. Well, do you ladies have anything else to add on this topic, or have we hit all of our...
I would love to just say, if there are parents who are interested in becoming a part of the solution and working on our coalition, again, we have about 35 people on our coalition, but we're always looking for parents. Their voice is so important, their perspective is so important. So if anybody's interested in working around this issue or some part of substance abuse, we'll welcome with open arms anybody that's interested in working with Healthy Futures Initiative.
So they can find that on the Healthy Futures website, and then folks can also get in touch with you by going to the Summit County website, co.summit.co.us, and then finding you under the Youth and Family Services.
Correct.
And Laurie, if parents want to give you a call, what's a good number to do that?
970-668-9196.
All right, fantastic. Well, thanks very much to both of you for coming today and sharing all this good info for parents and all potential users or even non-users of marijuana. So we definitely hope that folks stay safe and keep this out of the hands of kids. So thanks so much to those of you at home for hanging out with us for this episode of County Connection, and we will see you next month.